And then there was a second dog that talked with him. So they had like a singing contest and were trying to make different noises. But he did good in anesthesia. He had no problems at all in anesthesia. Woke up really, really nicely. He's already singing again in the back with the other dogs. So he should be doing well. His eyelids will be very swollen. They are already pretty swollen now. I froze all the hair on all 4 eyelids. So you will have a reaction to that logically. And they're normally very swollen the next day, and then every day the swelling goes down a little bit more. What would be not normal is that the swelling goes down first, and then it starts getting swollen again more. Or if you have really large areas where you get crusts on it or sores on it, that shouldn't happen. You will have red, yes, and you can have a little bit of oozing, but not really sore areas. And you should not see pus coming out. His eyes should really be open as much as you can open them, and they should be clear. If that's not the case, then call. Rather call once too often than not often enough. You can always text us or send us pictures over email, and we can tell you yes, that's normal or not. We try to freeze just to the eyelid margin so he doesn't lose any pigment, but that is one of the problems that we sometimes have, that when you freeze, you also destroy the pigmented cells, and sometimes you have little freckles. Most of the time they get pigmented again, but not all the time. So we tried in him especially, because you said you may want to show him. We tried not to freeze too far out. Hopefully he's not going to have any white spots. But he's doing well. The hair came out pretty easily. He had several of the areas, there were 2 or 3 hair in one of the glands, but they all came pretty easily out, so it shouldn't be a problem with the regrowth. And we didn't see any hair that grew through the eyelid. There were only the ones that come out of the glands where they shouldn't come out, but they are not the dangerous ones. The really dangerous ones are the ones that go, instead of up, go down. So you have like a needle coming through the eyelid, and he didn't have that, so that's good.
Well, like in the morning, do wipe them or?
Yeah, you can wipe it with a warm washcloth if there's anything on it. He shouldn't really have much discharge. What I would like you to do is give 1 drop tonight still in both eyes of the Neopoidex, and then start the carprofen tomorrow morning. You don't have to give the tablets tonight. Give them tomorrow with the food. It's similar to ibuprofen. Most dogs tolerate it well, but some of them get stomach irritation. If he doesn't want to eat or throws up, let us know and don't give it anymore. So it's the same, when you think about the side effects of ibuprofen, it's more or less the same ones. Give it always with food, and you don't have to give it tonight. We already injected it. He can have food as soon as he comes home, but give him a small portion. Give him like 6, 7 small portions first, because I assume he's one of the ones that falls in and inhales it. And if he does that on an empty stomach, he will just throw it up. So give him, he will think you spoil him rotten if you give him 6, 7 portions of food. Just give little handfuls. Same with the water. If he's crazy enough to fall in the water ball and try to drink the whole water ball, he gets small portions at a time. Water is normally not as much a problem, because we give them IV catheters and they have a lot of fluid going through them, so they are not really thirsty. But some dogs just, they have that thing, I want to drink and eat as much as I can, and we don't want to do that. Medication, I said already, drops tonight 1 more time, and tablets tomorrow. So that's all the important things. What we will do in about 2 to 3 weeks is we're going to check again. Some of the hair were too short, they're not looking out yet, they were still in the gland. They will slowly slip out, and then we can pull them after 2 or 3 weeks. They have no hair follicles anymore, but they are still in the gland. They fall out, we could theoretically wait until they fall out, but it can irritate, so we try to pull them after 2 or 3 weeks. And that lets us also check if there are any hair that still have hair follicles on them. And if there are any problems, you call. If you have any questions, you call, please too. So if he has any questions, let him call.
I have one question. Is he going to come out with a cone on?
No. He doesn't need a cone. So that's a good thing too. They always get irritated on their neck because these cones are pretty sharp, and they slobber in it and put the food in it, and then you have skin infections. He doesn't need that.
Okay, great.
He will have a little band-aid on one of his arms. I don't remember on which one he had his, where the IV catheter was in. You can take it off as soon as you're home. They are taking it out right now. We always leave it in until they go home, so in case we need to do something, we still have access to the IV catheter.
So is he going to be groggy for the next 12 hours?
What are you wishful thinking? He is pretty much back to himself. I would not let him play wild with other dogs, because he still has the medications on board. He still has the morphine on board that takes the pain away too, and sometimes that makes them crazy. The little kitten was crazy. She was playing wild with everything that moved, and she said, "What's wrong with her?" I said, "Well, it's the medication. She just feels good." play him some classical music.
Okay.
Okay.
Let me get him.
All right, thank you so much,
Well,
Claudia.
he wasn't groggy at least before, so let's see.
Okay.
Yeah,
He
okay.
may sleep at home.